more than 50% of men who are 40 years and above are actually experiencing erectile dysfunction. Don't go to a quack, don't go to a herbalist, don't go to all these places that I'm listing. J5. Hi guys, welcome back to my YouTube channel. I'm Dr. Hilda and my YouTube channel is about health and lifestyle. If it's your first time stopping by this channel, thank you so much for stopping by. I hope you enjoy my content and you consider subscribing. If you're new to this channel, thank you so much for coming here, being a member of this community. I honestly cannot thank you enough, and I just appreciate, I really appreciate from the bottom of my heart. So in today's video, I want to talk about erectile dysfunction, ED for short, commonly known as impotence. One funny thing is that while growing up, I thought impotence meant you cannot impregnate a woman and all of that, like you're infertile, but that's not what it means. It's another name for erectile dysfunction. So let's just get into the video. So erectile dysfunction means the inability to attain erection, sustain it sufficiently to attain satisfactory sexual performance. That's just what it means. So if you have problems in any of these aspects, you can't attain or you can't sustain, you're having some sort of erectile dysfunction. So erectile dysfunction is something a lot of men deal with. Research has shown that more than 50% of men who are 40 years and above are actually experiencing erectile dysfunction. It's very important that we know the common causes, the risk factors, and it. You don't have to wait till you start experiencing erectile dysfunction to know about it. You should actually know about it. And if you're experiencing this, it's also important that you know about it and you can identify what you practice that is making you experience this. So I'll just go quickly into the different causes of erectile dysfunction. It comes with aging. Most men, as they age, they begin to have some sort of erectile dysfunction just because as you get old, the blood vessels become more clogged and you just have a problem attaining this erection. So old age is a risk factor for having erectile dysfunction. Another important risk factor is lifestyle. There are some lifestyle practices that people practice that are actually putting them at risk of having this erectile function, but they actually do not know. Things like smoking, tobacco use can actually put you at risk of having erectile dysfunction. If you take excessive alcohol, illicit drug use, being overweight, and just taking a lot of junk and the rest of that can actually put you at risk of having erectile dysfunction. So let me just quickly explain so you will get the hang of this. So during stimulation, there's increased blood flow to the penis. That's what's going to lead to erections. If you have anything that's affecting these blood vessels, it will lead to erectile dysfunction. So there are other medical illnesses that can also cause erectile dysfunction. If you have uncontrolled diabetes, and take note that I said uncontrolled because if your blood sugar is controlled, you're unlikely to develop complications. But if you're unable to control it, you're not taking the right diet, you're not adhering to your medications, it will actually become uncontrolled and you begin to have complications in your blood vessels, in your nerves, and erectile dysfunction is one of the complications that can ensue. If you have uncontrolled and long-standing hypertension, if you have hypercholesterolemia, so hypercholesterolemia, so hyper means high, cholesterol means cholesterol, and amia means blood. So if you have high levels of cholesterol in your blood, just as I previously explained, when there's stimulation, blood flows to the penis. So when you have high cholesterol, this cholesterol fats is going to clog the blood vessels. Let's look at the blood vessels as some pipes and blood is flowing through these pipes. So these blood vessels are meant to take blood to the penis so that it can erect, right? But when you have cholesterol and fats clogging these pipes, that is the blood vessels, it's going to prevent erection from occurring. So that's just how it occurs. Like when you have a lot of fat, when you take a lot of junk and the rest of them. And that illness that can also cause erectile dysfunction is sickle cell anemia. Because in sickle cell anemia, they have some crises called vaso-occlusive crisis and can actually affect blood flow to organs. And this is also how they would have erectile dysfunction. I cannot leave out psychological issues. If you're dealing with stress, emotional stress, you're having anxiety, you're not sexually attracted to the person, you're depressed, all of this can affect the ability for you to have a perfect erection. So it's very important that if you're doing all of this, try to make yourself calm. Don't put excessive pressure on yourself. Try to be happy. If you're dealing with depression, see a doctor and see someone and seek help. Just try to make yourself happy. Talk to family and friends and just try to put yourself in that mental state so you're just calm. There's also some medications that can also cause this, like some antihypertensive, some antidepressants. I know this is very funny. Depression is causing erectile dysfunction. Drugs that are using to cure the depression too is still causing the erectile dysfunction. The thing is that there are different classes of drugs that can be used to cure depression. So there are a particular class of drugs that are actually notorious in causing all of this. There are some antihypertensives that can also cause this. So that's why it's very important for you not just buy over-the-counter medications. Try to get a prescription from a healthcare practitioner before you start taking the medication. So if you notice that you begin to experience this, try to speak to your doctor. Try to let them know that you're experiencing this, and you'll be given another class of drug to help you manage the condition that I'll just quickly run through the different ways you can prevent or manage erectile dysfunction. So let's start with lifestyle. If you're smoking a lot of cigarettes, you take a lot of tobacco, or you're consuming alcohol excessively, or you're using illicit drugs, you take a lot of junk, all these things are things that we have to try to stop, like, by ourselves. Nobody can actually help you do this. Yeah, people can help you, therapists and the rest of that, but you have to make a conscious decision that you're ready to stop this, because like it actually has a lot of complications. Even apart from this erectile dysfunction, it can cause cardiovascular diseases, can lead to a stroke. So it's very important that we stop all of this, stop smoking, cut down on alcohol, stop abusing medications. You can also lose some weight. When you lose some weight, it will help your self-esteem and also help to increase the testosterone level. If you have hypogonadism, where you have low testosterone in your blood, it's actually one of the important causes of erectile dysfunction. You'll be placed on hormonal replacement therapy, where you'll be given testosterone. So if you're having psychological issues, like you're depressed, you have a lot of anxiety, you're dealing with anxiety, you have a lot of emotional stress, you might just need psychotherapy. You might need to talk to somebody, like try to talk to a professional that can help you go through this. And it's very important that you do not put too much pressure on yourself. Don't try to pressure yourself and have some goals or unrealistic goals. Take it one step at a time, and you would actually see improvements. So you've stopped all the risk factors, all the lifestyle activities that are putting you at risk, your medical conditions are well controlled, or you don't even have any underlying medical condition. There are some medications that can be given to you. A very common example is sildenafil, which people take as Viagra. So it's very effective. It's known to improve erectile dysfunction in 70 to 80% of cases. So most people actually notice an improvement when they use these drugs. However, some people actually still keep on experiencing this erectile dysfunction, and it's very important that the underlying cause will be treated. For people who keep on having this recurrent erectile dysfunction, medications aren't working, they might need some other pump devices that help to take blood to the penis to help you attain erection. You may even need surgery. I trust your healthcare provider to come up with the best line of management for you. So if it's something you're experiencing, try to talk to a doctor, try to go to a doctor, like a medical doctor. Go to the right place so you're given the right care that you need. Don't go to a quack. Don't go to a herbalist. Don't go to, all these places I'm listing. Just go to the right place. I hope you enjoyed this video. Please share this video with someone who you think will learn from this, benefit from this. Share my video with people all around. Tell your family members, your friends about this channel. Tell them to subscribe and tell them to leave a love for me. If you watch to this point, thank you so much for watching to this point. Please give it a white heart. Just drop a white heart in the comments so I know that you actually finished watching this video, and drop a sweet comment. If you have any question, or if you have suggestions on videos, more health related videos you'd like to see, kindly let me know in the comments, and I'll really appreciate that. And I'll see you in my next video. Bye.
Go, go, go.